Good afternoon, everyone. My name is Rebecca Saltzbaugh, and I am with the Christopher and Dana Reeve Foundation. I'd like to welcome you to today's webinar on women and aging with paralysis. Thank you all for joining us for a panel discussion on this very important topic. Before we begin, I would just like to cover a few housekeeping items. We do have closed captioning available in both English and Spanish. To access the English closed captioning, you can just click on the button down at the bottom of your screen that says CC Live Transcript. And if you'd like to access the Spanish captioning, that you can do through a link that's available in our chat feature. You can just click on that and the closed captioning will come up in another window. And in addition, we will have time at the end of the panel discussion at the end of today's webinar for questions, audience questions. So if you have a question for our panelists, please enter it into the Q&A feature, again, at the bottom of your page, and we will get to as many questions as we can. And with that, I'm going to turn things over to our panelists, and just thank you again to everyone in the audience for joining us.
Good afternoon, everyone. Thank you for attending today. And to begin with, we're going to introduce ourselves, the panelists. I'm Linda Nora Davis. I'm going to be both a panelist and the moderator today. I am a T6 para, and I have been for 46 years. I've worked in the legal profession for the past 34 years, and I am currently 64 years old. So I know a lot about aging with paralysis. So I'm going to move from my left to right. And Patty, would you like to introduce yourself?
Sure. I'm Patty Kunza. I'm 59, living in Virginia. I'm a T4 complete paraplegic from a car accident in 2009. I've been a registered nurse for over 35 years. And ironically, I started my nursing career in spinal cord injury unit at a VA hospital. Some of the ways I've been involved through the Reeve Foundation as I've been a peer mentor to others with spinal cord injury. I review some of the grant requests that come through, and I had the privilege of being a co-writer for a recent booklet distributed by the Reeve Foundation titled Women's Mental Health After Paralysis. Today, I'm honored to share that knowledge that I have and experience with all the others with spinal cord injury and aging. Thank you.
Thank you, Patty, and thank you for all of your contributions. Helena, would you like to introduce yourself?
Hello, I'm Helena Sparling. I was injured 11 years ago in a car accident. I'm a C6 complete. I have no hand function, but I can move my arms, basically paralyzed from the chest down. I worked in the real estate business before I retired. I now am a grandmother. I work part-time managing my businesses, and I love to travel and I love to stay active.
Thank you, Helena.
Oh, I forgot my age, 72. I may be the oldest of the day.
Wow, 72. So you
Yes.
really have and bring to this panel a lot of years experience, and plus many years past what many of us consider a prime for aging.
Yes.
So thank you for your contributions that you're going to give to us today. And Carol, would you like to introduce yourself to the group?
Good afternoon, everybody. My name is Carol Evans. I am a T11, T12 paraplegic. I have been a paraplegic for 34 years. I am now 55 years old. I currently work in the HR industry and have been in HR for 20 years. I've done drug and alcohol counseling prior to that. I am a licensed foster care parent as well. I have one daughter and two beautiful granddaughters. Well, my daughter's beautiful too, but granddaughters have a special place in my heart. So I've come to bring you what knowledge and experience that I've had over the last 34 years of rolling around this world.
Well, thank you so much for that, Carol. And 34 years is quite a number of years. And I'm quite sure you have a wealth of knowledge that you can share with us today. So to begin this discussion, we're going to talk about some of the obvious first, and that is the physical changes that are associated with aging. And from your perspective and your personal experience, what are some of those physical changes that you have experienced while aging with your paralysis? And anyone can just volunteer to talk first if you'd like.
Well, I know for me, myself, I've noticed that after you've hit the age of menopause, it seems like for all women, whether you're able-bodied or not, putting on weight is difficult. Well, when you're in a chair and you're a little bit less active than some of the able-bodied people, I have noticed that that weight around my gut has become more and more increasingly, which in turn has caused it to be a lot more difficult to transfer, be able to do some of the things that I used to be able to do so much easier. I don't feel as safe sometimes in my shower because my transfers aren't as good. And you know, your body just kind of naturally ages and things happen to it. And I think with us being in a wheelchair, those effects are magnified per se, because a lot of our bodies, we depend on other parts of our body to help us to accomplish the same things that other people do not. So me personally, a little bit of weight gain has been difficult. The transferring in that has become difficult. And I'll let somebody else speak on that as well.
I found the weight gain too has been a problem. I'll second you on that. But also I found that the normal parts of aging have a tendency to affect us just the same as they do the general population. And for me, I've gone through cancer and through some heart failure and had to be in the hospital a couple of times. And I find that trying to work through the traditional medical world with a spinal cord injury sometimes can be challenging. I found I needed to advocate for myself and be able to explain to hospital staff and doctors and people I was dealing with what to expect from my injury. And sometimes maybe educate them a little bit on how I'm a little different from everybody else that they're dealing with. And I think it's important to go into that with a positive attitude, but to recognize that not everyone on the hospital floor has had the opportunity to take care of spinal cord injury patients when you're in the regular hospital and not in a rehab center.
Right. Yeah. Patty, do you have anything you'd like
Well,
to contribute?
just some of the things we were saying about the gain in weight. I know that I've gained a lot of weight after my spinal cord injury. Like I said, mine was recent, so it was 12 years ago. But I've started now watching what I do eat and eating a lot of fruits and vegetables and really trying to at least get that protein into our body. But I feel like I've been losing some weight because of that, because it does make, and I know Linda knows a lot of the experiences here, but I just find that I don't have the help that I did have. So I find because of that, I have to start watching myself. And it goes back to what Helena said too, about being in the hospital and being your best advocate. Because if you don't take care of yourself, nobody will, unfortunately. So yes, we have to take care of ourselves and be our best advocates and be the best that we can be for the reasons. And I think the transferring, that comes with the age, but that comes with age for anybody. Because I know as I was getting older and I was walking, I was terribly slippery and falling and things like that. So I just think it comes with age too.
Yeah. In addition to the difficulties with transferring, i.e. because of weight gain, what I've experienced is that my technique was horrible because my body just wasn't comfortable or strong enough to transfer the extra weight. And when I reached menopause, like Carol, it was like, oh my goodness, you know I've got the parabelly, but what is this other stuff? Where did that come from? But because I was experiencing a lot of pain while transferring, because my technique was so poor. And as a result, my technique was poor. I was afraid of transferring more. And the more fear I had, the less I wanted to transfer,
Mhm.
the less active I became. And of course, the more weight I gained. It was almost like I was just feeding into
Mhm.
one problem after another.
Right.
But also, the issues of aging and with a disability means that osteoporosis is such a problem.
Mhm.
Yeah. Something that I learned I should have addressed sooner than later. I don't know what you ladies' experience has been, but mine has been that, 50 and 60 was just too late.
Right.
I've got issues that um, I can't reverse to a point where I'm going to get stronger. So,
Right.
uh, has anyone else had those similar experiences with the bone density and the loss in addition to that goes along with aging for walking
I
and non-walking people?
I personally had an experience that I'm glad you brought up because I was hoping to discuss today. In 2017, my back was hurting all the time, and I went to my regular doctor. Of course, he prescribed me pain medicines, and it just would not go away. So I work for a hospital facility currently. So I was asking all my friends, like, who's the best spine doctor there is, because there's not a lot of SCI stuff around the area that I am in currently. And so I went to this doctor. Well, found out that I had not only had osteoporosis, but because I've been sitting for the last 30 years at that time, I had some disc compression. Um, so my discs had kind of jammed all together from me just sitting for since I was a very young adult. And so therefore I ended up having to go into the hospital, had a surgery where he had to fix decompress my spine. I actually had to do 5 surgeries. Long story. I ended up getting very sick and having a staph infection. But this is where, when Helena was speaking earlier, that we have got to be advocates for ourselves in the hospitals. I wanted to go to a hospital that I knew was top-notch hospital for my surgery. And so I did, but the nursing staff had no clue. They put me in a room that they thought was wheelchair accessible, and I couldn't even get into the restroom um, to do any cathing or anything like that. So being a self-advocate and knowing what you know that you need is very important. And I also learned at that time, not only is that knowledge important for me to have, but it's also important for some of my family members to have as well.
Yeah.
Thankfully, my daughter has never seen me walk, so she knew some of the things that I needed and was able to verbalize that. But she learned a whole lot more over the years, because I'd never told my daughter about a bowel program or self-cathing or stuff, because she was young and there was no need to discuss that. And by the time she's an adult, like, how do you say that to your children? And so for me personally, and maybe that was some of my pride, I never had told my daughter about these things until I was in the hospital, and she had to actually advocate some things because I was in and out of awareness. So I think, being, like Helena was saying, just being a self-advocate for yourself, knowing what you're going to need, if at all possible, planning those things prior to going into the hospital. My surgery was scheduled, so it was something that I should have known to go and look in ahead of time as to what was going to end up happening. I ended up having to use a bathroom that was down the hall. So I had to get up, get dressed, go down the hall, use the restroom. And finally, I'm like, no, let's just go ahead and put a Foley in. This is ridiculous, So there are those things that we need to be aware of prior and ahead of time. And also, I've learned myself, it's very important to let your family know. At least have it written out on paper if you're not ready to have those discussions with people yet, so that if something does happen, that they know where to go to get information that they need to fight for you for.
Yeah. And in terms of advocating, how do you advocate skincare? How do you say to someone, I'm older now, and possibly um, it's not my neglect. It's not that I'm not taking great care of myself. I'm just more at risk now. And me personally, I've had to um, now bite the bullet and allow my sons to check my bottom
Mhm.
for me,
Right.
which is part of me that I was holding on forever to. But now that I'm older, I can't afford to because I know I'm at greater risk. And I have had more breakdowns in my years between 60 and 64 than I had between 30 and 60. Yeah. So I hear, that we all are trying to learn how to advocate for ourselves. And I'm going to Helena with this is, have you had an opportunity to experience having to advocate your skincare to either healthcare staff or to family and friends?
Oh, yes, I have. I had a pressure sore that I had to have treated professionally just a few months back, but I'm blessed to have a full-time caregiver that lives in with me. And we are absolutely shocked sometimes how quickly something will open up on the skin. And
Mhm.
I remember my therapist telling me when I was first injured that we needed to check the body every day for skincare, and that really is true. When we can catch a place that starts to open or turns red early, we can put the magic lotions on it and put band-aids across it, the bandages, and a lot of times slow it down. But this one time, it just kept going, and it kind of got back to I finally traced it to my wheelchair cushion that I had sat in for the last 10 years, thinking it was perfectly wonderful and wouldn't give me any problems. And of course, it had broken down and was exactly what was causing the problem. And I should have been a little more aggressive early on when I first started having the problem. By the time I went in to see the doctor, it was up to stage 3. And she looked me square in the eye and said, at stage 4, you go into the hospital. I did not want any part of that.
Yes.
So I listened to everything she said and followed the regime completely. But, I think it's important to become creative on however you can check your body, whether it's using hand mirrors and looking at the back of it yourself, or if you're a quadriplegic like I am, having someone who's helping you do the check. I just think it's what you can't pass up.
Right.
Because you sure don't want those 2 or 3 months in the hospital laying on probably your stomach.
Yes,
Yeah.
absolutely. Yeah.
Yeah.
And then, the issue of not, you lose some independence when you're faced with a breakdown,
Mhm.
a lot of
A
independence
lot of
because,
independent.
yeah, you're depending on others. I hear you saying it, Carol. I hear you saying it, Helena. And I know Patty has experienced it
Mhm.
also. Is that lack of independence
Right.
and not wanting to have to rely on other people, for that kind of special care.
Right.
And it is a special care. Um, what has your experiences been when you've had to depend on others? Was it a good experience? I know psychological that loss of doesn't necessarily feel good, but what has your experience been? In terms of the caregiver who's giving you the care for that specific issue of your skin breaking down, or family members, or just having to depend on yourself. Some of us only have
Right.
ourselves. Yeah,
Yeah, Linda, let me jump in here.
sure.
Just real quick to go back to the osteoporosis. I just want to make one little comment that 6 weeks after our injuries is when this bone starts to break down. So we just need to be aware of the bone density test that we all probably should be getting, but
Mhm.
this nurse has never gotten one. So just so you
Mhm.
know, just so you know, these things happen. But
Yeah,
I need to get one. But
yeah.
just to say about that, I lost my husband 3 years ago. And I had a husband that did everything for me because he didn't want me to struggle. And when he passed away, I now had to train a new person to keep an eye on my skin. And my sister does. My sister does it now for me. But it's that whole losing that and then requiring training, retraining somebody as to what needs to be done for your body. That's the tough part of that.
Yes.
And that goes along with going in the hospital and retraining people, or training people, not even retraining, training them as to your care, as to what needs to be done too. And it's just like, goes back to being your own self advocate, because as we age, we're going to start losing these people that have helped us out. So right now, I've got several that kind of know what to do for me if need be. And the other part is, what if we go in a hospital and we're unable to talk or to educate? We do need to let others know what needs to be done for our own care. And that's where I've started now. We're trying to do that. And I have 2 sons, so I'm not there for sharing that information with them, but my sister does. But what happens if something happens to her and she can't do that? You know, it's unfortunate as to us as aging with spinal cord injury as to how we're going to be getting along with that.
Right. I see, Carol, you were affirming just about everything that Patty was saying. What has been your experience?
Yeah, I have found that, like I said, it is very difficult to have those discussions with our adult children.
Mhm.
You know, I have struggled with it personally. And I'm super close with my daughter. I mean, we're like best friends now, but it's not something that you necessarily want your children to know, that
No.
you're on a BOW program, or that you're, and like I said, when she was younger, there was no need to have this discussion with her. And now that she's an adult, I might have waited too long to tell her, but BOW programs, self-cathing, things like that. And skincare. Skincare is another thing. I have not had that discussion with my adult daughter as to skincare. Yes, I do check my skin. And then now listening to Linda talk about how it's gotten worse for her in the last 4 years as she's aged, that this conversation is so good, because even us as panelists, I'm sitting here thinking, I need to do a better job of making sure that I check it, because I've always taken it for granted that I've not had skin issues. The only time I've ever had skin issues was going into the hospital. So now I have to teach my daughter that these are things that she has to be aware of. And I love nurses and being in the hospital and knowing that those people care very much for us. But skincare, BOW programs, self-catheterization are things that they are not aware of. And so you have to have those conversations up front. This recent back surgery that I had, I was in a rehab facility trying to get my strength back. And I was discussing with them my BOW program, and the nurse flat out looked at me and said, "We do not do those here." And I just looked at her and I'm like, "Well, I'm sorry, you're going to have to do those here because I'm unable to." So I actually had to have a conversation with the medical director of the facility saying, and it's not ever comfortable. Nobody wants to discuss their bowels. We all have them. We all have to use them, but none of us want to discuss them, able-bodied or not. But so you have to learn to kind of be brave and have those discussions with whoever you need to. Be nice about it. I mean, I was very nice with the medical director. I was like, your nurses are telling me that you guys don't do bowel programs here. I'm only on a bowel program. They tried to constantly give me laxatives, and I'm like, this is not my bowel program. And they kept wondering why I was having accidents all the time. And I was like, this is not my normal. My body is reacting to. And so we have to know our normal. We have to know because what works for me is not going to work for Patty, is not going to work for Linda. Every one of us have a different body system and how we do our different programs. And just be strong and just try to teach the person that you need to, whether it be the medical profession or a family member. This is what I need for myself. Those laxatives was the worst thing. For 2 weeks. They kept giving them to me and I kept fighting them on it. And finally I was like, I'm not taking these anymore. When they finally stopped giving it to me, I was able to regulate my bowel program again, and it was great. So if I can say anything to all the participants out there, know your body, know what you need for yourself, and make sure that you have a support system, whether when you go into a hospital, whether you're, even if it's an everyday thing. I've fallen and broken my leg before and have had to have my daughter kind of help me just do things at that time. So just anything that you can is my advice, is just to know your body and to really fight for what you need in a good way, not a negative fight.
Yeah.
And I agree with Carol there that nurses are not taught spinal cord injury. So if we have to be the advocates. But going back to your laxatives, the laxatives are going to cause you to have diarrhea. If you're laying in the diarrhea, you're going to have the skin breakdown.
Yeah.
So it's like a vicious cycle that you've got to know what's going on with your own body to be able to advocate for yourself.
Helena, you seem to be a very strong, to the point
Uh-huh.
kind of person about advocating for yourself. Give us an example of how you would handle a situation when you're in a hospital facility and they just aren't adequately prepared for you as an aging woman with paralysis. I mean, how do you approach it?
Well, first I come with all of my own preparation. I've been in the hospital, enrolled in my shower chair to handle my bowel program with, and I bring my catheters and diapers. I still wear diapers, I hate to say. So I have all the supplies and everything that's necessary, and which I hope makes it easier for the nursing staff. Also, my caregiver, Sweet Essie, is there. My daughter happens to fortunately be a nurse from the ER. So Essie could help explain. I've had a couple at one particular time when they were doing the nurses change over to a new shift, and there's this new young lady I'd never met before. And the nurse had been on, introduced her to me, and then introduced her to Essie, that she's her caregiver and she can help you. This huge sigh of relief came out of this young lady's mouth. She said, "I'm so glad you're here." So I think it's helpful to take the attitude when you're in the hospital to help give them the tools necessary for them to care for you. And that doesn't mean necessarily that someone else is doing everything for you, but someone is there to help help guide them through the process, and because they really want to do what you need and to treat you in a way that will be beneficial to you. But quite often you need to supply the tools necessary all across the board. And I've never had to talk to a doctor about it, but I think that ultimately, if you really are having a difficult time, you should ask your doctor to intervene. But it's never been an issue. It's just mainly been education level. For me, I guess I've been in the hospital like 3 or 4 times since I was injured.
Well, many of us either don't have a family member or friend to advocate for us or to be there. I myself lost my husband 6 months ago. So he was the person that made sure everything was done for me. He was the person that, protected, if you will, my vulnerabilities. I feel vulnerable now because now I have to trust people that I normally would not trust. I'm having second thoughts. I'm not just used to being in the position of advocating for myself when you have a family member that does that for you. And many of us don't have that. And which leads into the next topic is the loneliness. The loneliness that you experience just in general as a woman with paralysis. Things change. Friends change. They go away, they move away, or they don't come around as often. And that's one of the things I know I'm experiencing as I've aged, in that I have a smaller circle. It's even smaller than it was when I was 30. So, what are some of the experiences that you've had? Do you think aging with your paralysis has impacted how often you have those feelings of loneliness?
I'm just not a very lonely person, but I know this last year, all of us have had to be sequestered in our homes much more than before. So it's important to try to put together a network of people that you can communicate with.
Mhm.
For those of us who have higher level injuries, who are quadriplegics and have less and less function, I think it becomes even more important as we age to try to have a network of people that can help us and that we can turn to. And even something so simple as having a peer mentor, somebody that you can call that's in a similar situation that you are in, and you can talk to about what you're facing and the issues that you're having. You may find somebody else who has already addressed that problem. I know for many of us, we are walking down the path. Well, I like to think to recovery because I'm always working towards recovering, though we know we'll never walk again. But I want to always be looking over my shoulder behind me and seeing if I can keep people from making the same pitfalls and same mistakes I made along the way. And if each of us put a hand behind us to help the one coming up newer than we are, that we can help, and then reach a hand out in front of us to ask someone on the path ahead of us how they can help us out. I think it's very helpful.
Oh, thank you very much for that. It's encouraging that there are us out there that realize that we do have a responsibility to each other. We can advocate and educate for each other. And, you know, we're the seniors. So, yes, mentoring and being honest. I mean, honesty, I think, is just the best policy for reaching out to the younger ones and making sure that they don't experience some of the things that we have had, particularly, and I want to go back to what Patty said earlier about the bone density test. You know, I did not have the bone density test until I fell out of my chair and broke my leg in 3
Mhm.
places. I was 63 years old, just addressing bone density.
Right.
And my test indicated I was a -3. Normal for a
Mhm.
woman my age is between +1 and
Mhm.
-1.
Right.
So we'd like to say to our younger women who are not yet where we are that you should start early.
Right.
You should start early taking care of your bone density.
Mhm.
Making sure that you don't wait till you're 50 or 60 to have your first bone density test. In my opinion, we probably, and this is just my opinion, I'm not a healthcare provider, you should start about 40.
Right.
Yeah.
You need at least a baseline, as you're saying, Linda. You need a baseline. I've not done that. I don't like being a patient. I need to do that. I need to do a colonoscopy. Haven't done that either. So I need to do those things. The prep of a colonoscopy scares the mess out of me. So I guess, Helena, you probably have had yours.
Oh,
And
yes.
probably, Linda, you've had yours. I've
Yes.
not. I've gone as far as to talk to the doctor and get the prep, but I haven't taken it a step further. So,
You'll be
so yeah,
glad when you have it behind you for sure.
I know
Yeah.
that.
Yeah.
I know. So yeah, so that and there again, and going back, Linda, to what you were saying, my husband did all of that stuff for me. He did everything to take care of me. And now suddenly I've got to go down this road by myself. And I know with him, he would get me out every week. Well, I know with COVID, it's a little bit difficult, but I find that my phone is beside me. I've got a great group of women. There's several women's groups on Facebook that are women with spinal cord injuries that I'm best friends with. I talk to them all the time. And I just find that I guess you kind of have to go looking for people similar that can be your support person.
Mhm.
And I do have several of them, and I'm blessed to have them.
Yes.
I'll tag in a little bit on the osteoporosis. It's
Mhm.
not just getting the test, as far as I can see. It's also establishing an exercise regime
Right.
that you're working out constantly. If
Mhm.
you have the option, have the option to get a standing wheelchair or a
Yes.
standing frame, something that can help you put load bearing on your legs.
Right.
Going to a swimming pool might be an option for some people,
Mhm.
but anything you can do, exercise, and all the keys that normal bodied people have for treating and avoiding osteoporosis applies to us too. It's just that we're, I think, much more vulnerable to it since we're sitting all
We
the
are.
time.
Yes.
We are vulnerable, and there are meds, to help halt the progression. It's not going to possibly rebuild the bone density, but it'll at least help stop what's happening.
Mhm.
So, there's options, and there again, going with options, talk to your doctors about your options, that
Yes.
you don't have to go with everything he says or he or she says, but you discuss the options and then decide what works best for you.
Yeah, my experience was I was given the option to get a yearly injection.
Mhm.
Um, that works well if you have very good pain insurance
Right.
and if they cover it at all.
Right.
Mine's did not. So the first injection was actually $1,200, which is cost prohibitive for most of us.
Right.
So, yes, you have to explore those options. Now, I'm doing things like making sure that, I'm on a regular regimen of Caltrate and vitamin
Mhm.
C and vitamin D.
Mhm.
Those are things I can afford to do.
Right.
But again, I think it is a good idea to consult your healthcare providers, find out what those other
Yes.
options are,
Right.
um, and try and find one that fits into your
Mhm.
budget.
Right.
That is so. Don't get discouraged.
Right.
I was a bit discouraged with the $1,200. I can tell you that. Um, but I didn't want to go through another broken leg because my fall was not a major fall.
Mhm.
It was, I sort of just kind of slid out of my chair,
Mhm.
just
Right.
kind of gracefully slid out of my chair and had no idea until the next day that I had broken my leg in 3 places.
How did you
So,
know, Linda? How did you know your leg was broken, though?
well, I got the
Okay.
swelling and the change of color
Okay.
the next day. I didn't experience a lot of pain, but the swelling was such that it was obvious something was up.
Did you have any autonomic dysreflexia from or
Absolutely none,
none? Okay.
none,
Okay.
none. And in a way, that may have been welcomed in
Right.
that I may have seeked care sooner,
Mhm.
but I didn't. So that's another thing that could be an indicator for you.
Right. And that's what I was
Um,
just asking, that
yes,
if we break bones, how would we know? So that's
yes,
what I was asking. Yes. Thank you.
yeah, yeah.
When I broke my leg, one of the things that happened was it swelled up as Linda did, and I
Mhm.
gracefully fell. I was transferring, and my chair just slowly slid away, and I just slowly went to the floor, and I heard snap, and it was my femur bone. But I started just vomiting.
Mhm.
I didn't feel sick or anything, but as soon as it snapped, I guess it was my body's reaction. I
Mhm.
just started vomiting and called the paramedics, and they immediately had to take me to a hospital that could deal with femurs and being a paraplegic as well. But one thing I really wanted to comment on, we're talking about colonoscopies and we're talking about the osteoporosis, but one thing that's also, I know when I hit 40, I didn't want to do my mammogram.
Mhm.
And I was scared to death because how are they going to do a mammogram with me? Like what options do they have? And I am blessed, as I said, that I work in a hospital system. So I was able to reach out and talk to some people. And they advised me, these mammogram machines, Carol, go really, really low. It's not a
Right.
problem. Go do it. So women, every woman that I know, when they hit 40, I don't care if they're able-bodied or not, tend to think mammogram, oh my gosh, I'm scared to death. Don't be. Women, please go out there and get those mammograms
Mhm.
because one, they're not comfortable, but they are not as painful as you hear all these horror stories
Right.
about. You know, two, they have machines that will adjust to your level. I mean, I literally don't have to get out of my wheelchair. I roll up to the
Mhm.
machine. I sit a little crooked, place the person places the breast on the machine, and then they do the mammogram. I'm out of there within 2 to 3 minutes.
Right.
So please, what you need to do to take care of your health, it's so important. Do not let this chair stop you. The colonoscopy is a thing that has stopped me because, as Linda has or Patty was saying, it has literally scared the crap out of me.
Mhm.
I don't want to do the prep for it because we all have bowels that we don't control. And what is that going to do for me? I've gone so far as to my doctor has given me the one that you can send off in the mail for a pre-test. And I haven't even done that yet. And that's neglectful on my end. And I need to stop it because it's nothing. Our health is nothing to play with. As we get older, we want to be around for our children, our grandchildren. And I was told the day I had my accident or shortly after that my life was cut by 10 years just because I had a major trauma in my life. Well, I had another major trauma in my life when I had to go do 5 back surgeries and had a staph infection. So it was cut another 10 years, supposedly. That's 20 years that they're saying that this trauma has cut off in my life. I'm refusing and I'm going to do everything that I can. So I want to encourage everybody that's behind me, as Helena was saying, to reach our hand back and help the ones behind us. Learn from my mistakes of not, I was young and carefree. I was doing whatever I wanted to do. And I'm not a vitamin person. I'm not one that likes to work out. Recently, I'm starting to do a little bit more. I got a hand bike. My legs are so atrophied that they are in this position constantly. I can't do a standing frame now. When those PTs tell you to stretch your legs every day, when I was 20 years old and they told me that, I was like, okay. And then I got home and life happened and I never did it. Well, I'm regretting that decision at 55 now. So I just really want to encourage everybody to start now. I don't care if you're on this call and you're 19 years old or if you're 45 or 75, start someplace because you will, in the long run, be glad that you did it. It's not going to always be easy. You might have days that you don't feel like doing it because we all do that. But I'm just encouraging everybody to keep pushing on, get those tests done, get your mammogram done, get your colonoscopy done. And if you don't want to do the full colonoscopy, at least send off to you see the commercial on TV all the time with the little guy with the poop. You just send it in and they diagnose it for you. At least it's a beginning for you. And then it will scare you if something is wrong, then you'll be like, oh, it doesn't matter. I'm going to get this colonoscopy done no matter what. We've all had friends that's had breast cancer. We've all had friends that's had some kind of cancer in their body, and we have to do our part to make sure that we fight that as well, just like anybody else. And don't let the spinal cord injury be an excuse for your health to decline.
Yeah. I had breast cancer, caught it on a mammogram, probably am alive today being no cancer because it was caught very early. It's the same for me as it is for any able-bodied person. Yeah, those cancer cells, they need to catch it. And just a little side note on the colonoscopy, my doctor put me in the hospital the night before, put me on a floor of nurses that handle colonoscopy prep work for people who cannot walk a lot or having difficulties. So it was much better than trying to sit on the toilet all night myself at home. But there are ways that they can handle it.
Yeah. Well, thank you for sharing that with us, Helena. I didn't know that you could actually talk to your doctor about possibly just admitting you for the night. And getting some assistance, because if you are a woman who needs her colonoscopy and you live alone, maybe you don't have family and friends, or maybe your caregiver is not available all night. She has a family that she has to go home to. So thank you for sharing that with us, because I didn't know that I could actually had made a request to my doctor to allow me to be in the hospital for 24 hours so I can have that help.
It doesn't hurt to ask.
Yes. Or in the big A word, advocate. Advocate for yourself. Yes. In addition to some of the strategies that you guys have mentioned, what other strategies are there to help women who are aging or women who are thinking about when they get to their golden years? How do they address, what are some of the strategies to address the impact of aging that you could offer them? Besides, number one, making sure that you don't let fear overtake you.
Right.
Get those mammograms, get the colonoscopy. What are
I
some of the
think
other
I think
things?
one thing, Linda, I was thinking about too was when you're living alone, like I said, because our spouses have passed, that you think ahead for yourself. Like I've called the fire department and made them aware that I was living alone. I have the code, the digit code on my front door. They have the code to get into that door. Just things that I've thought about as if I couldn't, in case of a fire, case of emergency, what can I do to help myself? It's those little things, that you need to think about. It's having the Alexa, having the Google Nest, having any of those things that would help you get in contact with somebody else
Yes.
if need be. And now, the first time, like I said, my husband was doing everything. I started learning to independently transfer. And as doing that, the first time I did it, I fell. Where was my phone? My phone was in my bed. It wasn't on me. So I started putting my phone in my pants to keep it on me. So when I fell, because I was on the floor for over an hour before I could get to the phone to call for 911 or somebody to come help me get up. Just little things that you learn. You just got to think ahead as to what would work best for yourself.
There is an emergency prepared checklist out on the website, and I want to say it's the emergency something that I have done as well. It's a checklist to kind of let you know what to do in case of an emergency. Well, I really think it's great for people with SCI because it's just a reminder to have like extra medicines, have extra, it's just a nice little checklist to put into a bag somewhere in case. I live here in
Oh, yeah.
Texas. We had an ice storm in February that shut down the world. And I was, by the grace of God, my house was not affected, but my daughter and her family had to come live with me. And my mom had to come live with me because every place that they were, they had no power, no water, anything. But if that would have been me, I mean, I would have had my family but if I couldn't have drove because of the ice, my driveway is on a flat hill, a steep hill. My wheelchair does not do well on ice. As we all know, we kind of just don't stop. We just keep going.
Yes.
So I just really want to encourage everything. As my adult daughter moved out, I have seen so many things in my life that I've been divorced. So I've been single most of my life, my disabled life. But when she moved out, I started looking at things differently. Like, if I do fall, what am I going to do? I've had one day I woke up and both my wheelchair tires were flat and none of my brakes worked. I couldn't transfer. I had to call my daughter from her job to come help me. And it broke my heart. Like, I love my daughter with all my heart, but I don't want her to have to worry about me. So I want to encourage others to, have an emergency plan. I loved that Patty is saying to call the fire department because they can prepare. They know that I live in my house as well, just in case there is a fire. They know to get me and my puppy out. That's important. My daughter and I have a meeting location. Should there be a national emergency or a local disaster in the area, we have an area that we are to meet up in case cell phones go dead or something like that. I just want to encourage it. It's not that we're all about doom and end of time and conspiracy theories. It's about being prepared if that should happen. And having a backup with your medicine and change of clothes and maybe your medical documentations that you might need. Keep a copy of those with you in something that is not going to get wet or, I'm not going to say burn up because you'd have to carry a safe around with you, but keep a copy in a non-burning safe just in case. God forbid that should happen to any of us, but this is life.
Right.
I
Yes.
didn't think in February in Texas that the entire world would be shut down from us. I mean, we lost cell service, we lost water, we lost, there's homes that are still in disarray and unlivable. So if that should have been that should have been me. I don't have a place. My daughter's house is somewhat accessible, but it's not the best accessibility for me. So, what would I have done if that would have been me for the week? So I just want to encourage everybody that, yes, we're not trying to be all doom and everything, but we do want to encourage everybody to be prepared, because as you age, I know that my circle has gotten a lot smaller. I don't go out with my friends as much, mostly because I'm either, as you age, you tend to get tired a little bit easier than you used to. I tend to hurt a little bit more than I used to, and I just don't have the get up and go as much as I used to when I was younger. And so my friends, I heard somebody else say this earlier, my group of friends has been caving on me, and I'm only 55, and I have seen it slowly dwindling and dwindling and dwindling. And COVID has really done a number on everybody in this country, in this world. So as SCI, we got to make sure that we don't isolate ourselves. And because then depression sets in, anxiety can set in, suicidal thoughts can set in, because let's face it, it's not an easy thing. I tell people all the time, being in SCI is not for the weak. And so when you feel down, be encouraged that you are one of the chosen strong ones, because it is not for the weak or the faint of heart. It's not always the easiest life. It's an amazing life, and don't get me wrong, but it's not always the easiest life. So be encouraged and hold on to your friends and your family. And when those groups start dwindling and you feel lonely, reach out to whoever you have to, and don't let your mind start wondering that you're in this alone, that nobody else knows, nobody else understands, because we are out there. And Christopher Reeves Foundation has a wonderful peer mentor program that I am also a peer mentor on. And I just love being able to encourage newly SCIs that you're not alone out there. There are plenty of us. The world will make us think that there's something wrong with us, but there's more SCIs out there than probably any of us could imagine, unfortunately. So I just want to encourage everybody to not feel alone, to be prepared for things, and know that there is people out there that love you and keep wanting to encourage you.
Yes. And in addition to that, I want to add that the Reed Foundation has many resources for those of us who need to reach out, those of us who need to or want to connect. There is a peer and family support program, Mentors. There is also the Paralysis Resource Guide, which is a free comprehensive guide to living with paralysis. You might think that, I'll just wing this, but no, get that guidance. Helena talked about, just sharing it, putting it out there, um, learning from others that are in front of us and helping those behind us. With that guide would be a helpful guide for those of us who are just beginning the journey and those who are still on that journey. Also, the Reed Foundation website offers fact sheets on aging and also has a blog on how to self-advocate. But I know after today, we're all going to remember that face of Helena and Carol and Patty on how to self-advocate. Look at these women, they're amazing. And you can just look in their faces and know that when they're talking about what their needs are, they're getting them made and they're getting them met. So I hope that if nothing else you take from this webinar is that self-advocating is very, very important as you age, to be able to get the things that you need as your body changes. So also there is a booklet that I just love. I love this booklet. It's the one that Patty mentioned earlier that she had the pleasure of working on, the Women's Mental Health After Paralysis. It is an awesome booklet. I encourage you to take a look at it. You can also find it at the Reed Foundation. It is an excellent, excellent guide. They talk about the difference between depression and just feeling blue, and how to talk to your healthcare providers about what you're feeling. Um, Things like the pandemic, the freeze, those things can be triggers.
Mhm.
So the panel, myself, Patty, Helena, and Carol,
Mhm.
want to encourage you to use that booklet as a resource. So at this time, we're going to move to the audience questions. And I think our Reed Foundation staff has the questions for us.
Yes, I do. Someone asked, I'm 57 and 40 years post-injury. Have any of you noticed changes to your skin post-menopause, like it being thinner or less resilient?
I don't know if mine is from postmenopause or just the aging, that I think our skin just thins as we get older. And that makes it a little bit more difficult too. I don't know that I would assume menopause would play a role in that, but I don't know if it's only because of menopause. I think it's just getting older. Anybody
I
else?
Yeah,
What you think,
what
Linda?
I've noticed is that my skin was drier,
Mm-hmm.
and that um, times when I just could ignore extra care to my skin, now I have to be aware that I'm keeping it moisturized,
Right, right.
either through some type of bath soap or
Mm-hmm.
extra lotion that helps with that to avoid some of
Right.
that dryness. But I did notice menopausal that my skin did become a little scaly and a lot more dry.
And I do notice that more on my feet too, that my
Yes.
feet stay very dry, and we have to take care of all of that. And there goes along with that is just, be careful of the fungus and all that, to keep your feet dry,
Yes.
and lubricate it. Just be careful not to lubricate through the toes and all, because that's where the fungus will set up. But your heels and all, those heels break down very easily if you're not careful. So I do notice that.
Now we have
I've
another,
noticed-
oh, go ahead, Carol.
I was just going to say real quick, I've noticed that if I avoid products, lotions that have perfumes in it, that
Mhm.
tend to dry me out a little bit more. I personally have found a couple of really good ones through CeraVe and Aveeno. I
Yes.
also have itchy skin, so those have helped very well for me. And so
Mhm.
just a suggestion to those out there to try to avoid the perfumes because they
Right.
tend to dry your skin more.
I agree.
Well, I'm going to
then-
encourage you to find perfume in another way, because I am all woman. I like smelling good. So
I agree.
I may not use it in my lotions, but I'm going to find a way to maybe put it behind my ear so I can
Well,
feel pretty.
that's my thing, Linda. If you're sitting in a wheelchair, you still got to look good.
Yes.
So,
And smell
yeah.
good.
And
Yes.
smell good. Yes.
Yes.
And then another question that we had from our audience, do women with spinal cord injury have different menopausal experiences? Can you talk about that a little?
I want to speak to that, and I can just say that I was disappointed and uninformed that I could not have hormone replacement therapy, because as a woman with paralysis, I am high risk for blood clots.
Mhm.
And so the symptoms I was having, I just had to live through them because I could not do the treatment. So if the question is it different for us? I would say yes, because many of us cannot use the traditional treatments
Mhm.
of hormone replacement that many women use to minimize those symptoms, the discomfort. I was able to take Prozac to manage my mood swings,
Mhm.
and possibly the beginning of mild depression.
Mhm.
So, in that sense, I was able to partake, but otherwise, I was not, which I didn't know. I wasn't prepared for that, um, which means that I had hot flashes every 10,
Mhm.
20 minutes, which was just unbearable. Um, and I did have those mood swings that were, well, I guess my perfume, I was smelling pretty, but I wasn't acting pretty. So I, I guess they canceled each other out. I hope anyway. But yes, it is different. Yeah, my experience was different. Yes.
And we'll squeeze in one more question here. Have you been able to use the required accessible medical exam equipment? For example, getting the tables lowered, and I believe they're referring to having a gynecological exam. And this person notes that when it comes to getting a pap smear, she needs 3 people in the room. And are there any better other choices or experiences?
My OB/GYN will put me in the sonogram room and use the sonogram table thing because it lowers a lot lower than the others. I do not allow, after my 5 back surgeries, I do not allow people to lift me up anymore because it's just extremely painful for me. And so I have found I'm one of those people that put off my pap smears for the longest time and would only do them sporadically because of the situation. And I finally started going to OBs and calling them and asking them, do you have a table that drops down to this height, 2 feet, 3 feet, whatever you needed. And I found one that would allow me every time she schedules the ultrasound room at my appointment time, and she allows me to go in there because it's at a level, it goes actually lower than what I need to transfer. And it's just really easy for me to do. So that might be a suggestion, is to call around until you find somebody that's willing to work for you. Especially, I'm one of those people, I do not like to be lifted up, not now only just because of pain, but I'm not a baby. I'm an adult. I'm 55 years old and I wanted to be treated like as one. And I find it a little bit degrading. And I know people mean from the bottom of their hearts that they are doing well, and I treat them like, I appreciate you trying to offer me, but I want to be treated with some respect. Let's face it, we have no respect when we go into the OB/GYN anyway.
Yes.
So, that's just me and a thing for me. So I try to teach people that thank you for offering to lift me up, but this is how I personally feel about it. Somebody else might feel differently. And so I find a table that works. And for the last probably 5 years, my OB's been letting me do it there, and it's been wonderful for me.
Thank you so much. And so we'll bring our webinar to a conclusion. Thank you very much to Linda, to Patty, to Helena, and Carol for just a wonderful, open, honest discussion. We so appreciate you sharing your experiences and your insight and your perspective. For those of you out there, a recording of this webinar will be available on the Reed Foundation's YouTube channel within the next few days. And thank you again for joining us all, and take care.
Thank you.
Thank you, everyone, for
Thank you.
coming.
Thank you.
Bye-bye.
Bye.
Bye.